My name is Megan Harrison and I work for Tameside and Glossop Strategic Commission. I provide support for GP practices in the area. I've recently been involved in a piece of work alongside the Covenant team in the council to provide support for military veterans. They'd done a piece of work where they'd spoken to veterans, to charities and to their local breakfast club to identify any issues with regard to the military veterans accessing primary care, particularly GP practices. So then they came to me and asked me to work with our practices so that we could look at these issues and enable the veterans to have a good service when they came along to the GP practice. We've been identifying them. We've been providing them with information, for example, with regard to the mental health pathway, and providing them with the Signal magazine, which Tameside Armed Services Community issue, and basically ensuring that they are not disadvantaged and they receive an excellent service from primary care by us working alongside Tameside Armed Services Community.
My name is Stephen Pleasant. I am the Chief Executive of Tameside Council. I'm also the Chief Accountable Officer for Tameside and Glossop CCG, which is a clinical commissioning group. When we started to look at the primary care record, i.e. the medical record by which the GP looks at medical history, what we found is, although we've got some in the region of 7,000 military veterans, actually there was only about 216 of them actually on the GP record, and I think that's no different than any other area. We're in a unique place because actually we run one single health and local government system, so I think really it was down to me to pick this up and try to do something different. So we took something through to our Health and Wellbeing Board, which is a joint committee meeting where all the partners come together, and we said this should be a priority for us. If you don't understand someone's medical history and you don't understand that somebody's a military veteran, then how can you actually really get under the skin in terms of what their health needs are? So it's a really critical piece of information. But secondly, actually, if you do understand that somebody's a military veteran, there's lots of services that are available that the GP can signpost to.
My name is Michael Harney. I'm an ex-RAF service veteran and served for 28 years. If the NHS service that you're using is unaware of the priority, then you are actively encouraged to tell them that you've served so that they can initiate a priority scheme. Failing that, you can enlist the local healthcare commissioners, your local authority covenant leads, or one of the national service organisations such as the Royal British Legion, SAFA, Help for Heroes, and they should be able to help you.
Hi, so my name's Kate Hebden. I'm a GP at Denton Medical Practice, which is within Tameside and Glossop CCG. We were approached a little while ago by the CCG to do some work around recognising military veterans within our practice. Obviously, as a GP, I've seen military veterans come into my practices, and we just wanted to see what we could do to try and support them better. So the main aim of this really is to try and identify them as the first step. So to do that, what we've done is put various things in place. So within our new patient registration packs, we now include something that asks patients whether they are military veterans, so that we can then code this on their records. And this is really important because if we know who they are, then we can offer them additional services. So if practices want to find out a bit more about how they can support military veterans, there's information available on the NHS Choices website. There's also a really good e-learning for healthcare module that's available that any professionals can log on and have a look at that as well.
My name is Major Daz Rawcliffe. I am the Battery Commander of 216 Battery Royal Artillery based in Bolton. As an ex-regular soldier of 33 years and now serving in the Army Reserves, I appreciate the importance of welfare within the armed forces. It is vitally important that once you leave the forces, you register your service details with your new GP. This will enable the GP to use the correct read code on their recording system. It is also key to inform the GP of any health problems, especially mental health. This also applies to older veterans or forces families members. It is also important for GPs to ask new arrivals if they have served in the armed forces or if they are related to a service person. I have seen at first hand the necessity for ex-service personnel to inform their GPs of their status.